basically are trying to understand why this sector is considered, complex when it kind of doles out these services. So there are different services under this particular sector that we look at, and these services would include, if you look at the context of UK, we will look at services like, clinical healthcare. We will look at services like mental health care. We will look at care home or, nursing services which are given out, and all this under the remit or one banner of healthcare as a sector, also poses some complexities as far as implementation is concerned, and it poses, looks at certain challenges which it poses while the implementation of these services is done by the NHS. Now, we also look at other factors very briefly, would be things like the role of private sector. Now, sometimes you will get to see that because as a welfare state, when we get these services, we take them for granted that, some of these services are provided free of cost, and we expect a certain quality, to be maintained while these services are, provided to us within that context. But when you look at the participation of private sector, in some cases, when they look at doing research and development, which is done in partnership with the private sector, pharmaceutical companies getting involved for the creation of new drugs or, new medicines. In those cases, sometimes we do get to see the policy or, the debates happening on the policy, which lead to the involvement of private sector. And to a certain extent, we try and look at their de-involvement in terms of providing some of these services at the front line, because it involves costs, it involves long-term contracts. And what we don't want to be able to do, which the government tries and balances, is that what is the role the private sector can play, but that role should not be a dominant role. So in some cases, we have policy debates which also tend to arise because of the complexity within this sector. Now, we do get to see that in some cases, when we look at the participation of private sector, things like health insurance policies, sometimes you get to see patients who are able to afford, though the basic care is provided free of cost by the state. But what we do get to see is, because of income inequality, people who are in the high income groups are able to also dip in and get private healthcare insurance, which kind of tops up the insurance or services they require from the NHS. So within this case, this also sometimes poses an issue. Say, for example, a case would be that if there is a waiting time to get, say, hip replacement or knee replacement within the NHS, sometimes patient, because they have private healthcare insurance, will go out and look at health tourism in other countries, get a replacement done, come back and expect these services or the post-clinical care to be provided within or by the NHS. And that kind of tends to pose, again, creates complex issues. Funding and financing of NHS has been in the news for a number of months and weeks now. So if you manage to catch the news and hear Jeremy Hunt and discussion happening in the Parliament, what they do say is the NHS is underfunded. We do not have adequate funds to be able to run services, provide basic services. Some of these things then also look at posing problems when we look at the funding and the financial element within this particular sector, because most of these services are under the public sector and the state provides the funding for it. But how much, and to an extent, how much can that be propped up every year once the budgeting is done, sometimes remains a question mark. And what we do get to see, that also poses some sort of creates some sort of an issue within this particular sector. So these are some of the complexities which we do get to see summarized here to understand that what kind of services the sector rolls out. But apart from that, when we look at these services, what are the complex issues which sometimes we encounter when we kind of assume or take for granted some of these services provided by the national service. Now, what is required to be done to achieve this change within the healthcare sector is that it requires a change happening in all different levels. So what we do get to see is that there is a change required in the governance. There are a lot of macroeconomic factors which affect the delivery of these services within the healthcare system. And what we look at is that income disparity, behavior of individuals, and certain demographic factors also affect why this change cannot be implemented sooner within this particular sector. So what this slide basically does is it kind of tends to divide the four key factors that we are going to be looking at studying, which affect changes or changes which are required to be done in this sector. And these changes would be kind of grouped across into these four broad types, looking at macro environment, which is external factors which affect the provision of these services and the implementation. We look at governance in particular, which would mean law and legislation, different laws and legislation and the policies which the governments introduce from time to time, which are turned into acts once approved by the Parliament. But there are a lot of revisions to these acts which keep coming from time to time, and their implementation has to be done in order to facilitate and bring change within this sector. And the last but not the least is what we will also look at the role of technology and some of the economic factors which kind of affect this particular sector, and those in tandem with the behavior of individuals, the income, and some of the other things would be looked at when we look at identifying some of these key factors. Now, in terms of understanding, how the system works, this is just a slide which I've borrowed from one of the reports from World Bank, which talks about how the provision of healthcare services or the delivery framework in general is created within most countries. And when we look at the factors which externally affect this framework in terms of its working are identified on the left hand side. So what we get to see is sometimes physical factors, economical factors. So we will study something called PEST, and what we will look at is these factors, which is political, economical, social, and to a certain extent technological, affect the developments and the delivery of services within this sector. Apart from that, what we do see is the government policies, which kind of create a major effect in terms of how these services are delivered. And finally, the most important component, which is the people which receive these services. So in between are the providers. And in our case, when we look at providers, the providers primarily in case of NHS, UK will be the NHS and associated, public sector enterprises, which are a part and parcel of NHS, like the PCC Trust. We look at the hospital trusts, the CQC, which is the Quality Care Commission. These providers, some of them which are social enterprises, look at quality and provision of services, how they're implemented, do audits and inspections. But in general, what we will see is externally some factors which will affect the framework when the framework is created. We look at government, law and legislation. We look at the providers, which basically are going to provide these services, and to a certain extent we look at the end part, which is the consumers or people or individuals who end up receiving these services. So these four important cogs actually become a part and parcel of framework when any country or any economy, when we look at country economy system, actually tries to create a healthcare system within the country, or creates a framework for delivery of these services within a particular country. And then what we look at is from time to time how economical factors, political factors, change in government changes the provision. So when you look at Tories coming to power, they did talk about we'll provide some extra funding to the NHS. So how the change in government policies affect the funding of this particular sector would be the things that we will look at it from a point of view of governance side. Now, if I have to look at summarizing the reasons of change, we looked at what are the factors which are leading to change. But when we look at why is change important, we need to also address some of the very basic questions in terms of before we even identify factors, we need to identify why change is happening or why change is required. So one of the things that we look at from just drawing some summary and inclusion from the slides we have looked at, one is there is a need for change. The need for change is happening because of the way the services are being delivered, the life expectancies are changing, the growth in population, discovery of new diseases or new medicines which help in treatment of some of these diseases or conditions, and that requires change within the system. Because if the change is not implemented, then you cannot have this provision being rolled out, in terms of providing these services to consumers or people within a particular geography country. Now, we understand the reasons of why this change is happening. What we also need to know is what are the various stimuli, what are the factors which are actually stimulating this change or which are forcing this change. Now, with the reasons why some of these changes are being forced, we will also look at in the subsequent slide, is also important to understand is because if things are perfect and if they are, okay the way they are, why do we need to change? But then there are some of these things which are driving or pushing us for change, and that is what we call factors or stimuli which are actually looking at, kind of forcing us to implement this change at a certain stage. And the third is there are some fears associated with change. So, for example, when we look at introduction of a new equipment from a point of view of treating or a new medicine or a drug being introduced, there are always pilot studies or cases which are done, and these research, which is done with a number of test patients to be able to perfect and see if the drug has any, say in the case of a drug, if it has any, negative effects before they are introduced for the consumption or for prescription within the NHS. Sometimes you look at there are fears associated with it. So a lot of cancer drugs, for example, if we are in tune with the news, what we do get to see is a lot of patients who want to get cancer treatment are not able to get it within the NHS because a lot of drugs and a lot of studies or a lot of research which is currently pointing to improvements happening because of new drugs and formulas being discovered is not yet available within the NHS because that has not gone through the proper period of testing and a proper period of approval before it can be recommended that this drug could be provided for treatment to patients having a particular type of cancer. So what we do get to see is the fears or the fear in general within, because the drug, if it is not trialed properly, can lead to negative effects or issues which could mean that it is something which is not perfectly tested, and that could mean that if it is trialed out on patients, then it could have severe consequences because it has not been, say, properly tested or thoroughly evaluated. So sometimes we do get to see fears also from an aspect that there is a fear to change, accept change. And that fear to accept change would be that, I've been comfortable doing this, but why should I look at a new practice and incorporate this in because when this system seems to be working. So a lot of technological changes being introduced within the, system in terms of when we look at NHS is also having fears associated with it is because nobody is very sure of the outcome or the positive outcome of the usage of that technology in treating that or in the usage. So sometimes we do get to see fears associated because of non-usage or no experience, no prior experience in terms of usage of that technology. So 3 reasons why we look at change. One is there is a need. That means we need to look at a change because the system or the law or the act has been quite old and it requires a revision. The second thing that we need to understand is why this change is required and what are the reasons which is kind of pushing us to bring that change in. And sometimes when we look at implementing change or implementing new technology to bring across a change, we do get to see fears associated with it, which means the outcome of some of these introduction or implementation of these changes is unknown. And that is why there's a fear associated with introducing that change into the organization. Is that okay?
Yeah, that's fine. Yeah.
Is that okay? Clear enough?
Yeah, it is, yeah.
Right, okay. Now let's briefly look at in terms of a few slides, which I'm going to try and go through quite quickly, which will back up some of the points that I've said. Now, if I look at one of the OECD reports, which has been published in 2016, what it identifies is high-level drivers of change identified in the sector till 2035. And what we look at is 3 broad areas in which these changes will be required to be done. So one is populations, the second is healthcare services, and the third is how healthcare professionals, HCP as we call them, people who work within this sector, need to be managed to deliver these services to patients, clients, or consumers in general across different geographies. So this particular report talks about trends which have been picked up across this sector, and they've divided it into 3 different categories. So for example, structure of population, long-term care. Now, when we say structure of population, we look at demographics here. So we look at a lot of immigrants which have come into this country have different background and different cultures from which they are coming in, and that kind of affects the population structure of the of the country. We look at long-term care now being required in cases of things like conditions like Alzheimer's. We look at dementia. Now these require long-term care, and because we are living longer, that requires long-term care to be given and provided to these patients who have these conditions. So they are factors which are all grouped under population. Okay. Now, in some cases, we look at people, wherein we try and also look at things like literacy, because if they don't speak a particular language or don't understand English, some of these things we do get to see, which the government is also implementing, is that anybody who's coming in, living in the UK, needs to embrace basic things like British values and have certain levels of English required to be able to integrate into the society, so that the level of care provided in the healthcare sector should or should not be differentiated on the basis of background, and this should not lead to inequality or discrimination when these services are provided within different types of different types of places or different types places and providing agencies which provide these services. The second thing that we look at is some of the factors which we identify are under healthcare services. So if you see in general, in the 1950s, when the NHS was introduced, the NHS was funded and was about 10 billion pounds of the national GDP. But today, the expenditure and the requirements in terms of funding for these services has increased, almost 100 times. That means it's become tenfold. So we are roughly in 2014-15, the NHS budgeting was about 120 to 125 billion pounds. So as you can see, there's been a tenfold increase, and that has led to more expenditures being done on services because we're living longer, and it is leading on from the point of changes in population life expectancy. The third thing that we look at is obviously a lot of regulation has been introduced. So when we look at last year, a lot of changes which came across specifically in regulation was that people who are on work permits, for example, within the UK, or are students who are studying in the UK for a say set specific time frame, have been now asked to contribute to NHS in terms of fees. So when you apply for a visa, apart from tourists, if you're coming in under tier 1, tier 2, tier 4, tier 5 visas, then one of the changes in regulation which was brought across, I think last year and the year before that, was that anybody who was here temporarily would also need to pay a surcharge to receive these services, and they no longer will be free of cost. So funding is one of the issues, and provision of these services is directly related to funding. So some bits of this have been introduced from a point of view of regulation, and what we do get to see that this trend will continue, and there will be further changes which will come out, and that is why this has been identified as one of the key drivers for change within this sector up until 2035. Now, when we look at health workforces, that means people who work within the sector, we do get to see that we have a huge shortage of professionals who are able to work within the sector and understand the sector and are passionate about it and are able to provide the level and quality of service which is required for the patients who are receiving this service. So we do get to see a lot of workforce within the NHS is from abroad, and there was an issue and it was discussed. It's still being discussed because of Brexit, that there are 55,000 professionals which actually work within this sector, which are EU members or basically not citizens of UK, but they are nationals of different countries within the EU, and we are reliant and dependent on the workforce which comes in and provides these services, becomes a part of the sector and provides these services here. So also, along with that, what we do get to see is the people who have entered the sector and have been working within the sector providing these services, there is a concept of aging which is happening, and that is where what we will get to see is that as we are living longer, a lot of these patients who work within the sector tend to retire early, but we will need investments in workforce. That means new training needs to be done. A lot of new people need to be, this sector needs to be promoted so that a lot of young professionals or people who are looking at coming into this sector have the ability to be able to come in. And, that would help provide additional workforce which is required, because care in some cases is now being provided for a number of years. And that would mean that we will need qualified, quality workforce, which is going to be one of the drivers, which has been identified within the sector, shaping up, till 2035. Now, lots of other things which is happening is that the health workforce is mobile. That means there's a lot of mobility. There tends to be changes in terms of profession. So when we look at somebody who's a qualified healthcare professional could move into a different sector or a different type of department to be able to provide these services. Sometimes you do get to see people working within the clinical side move over to the administration side after a number of years of experience, which means that we need to be able to have the ability to replace that person and have adequate backup so that the frontline services are not affected. When we look at A&E in particular, what we do get to see is that because the sector is slightly underpaid within the context of healthcare professionals, when you look at the different types, nurses, doctors, people working within the sector, we do get to see that a lot of people, when it comes to working within this particular sector of A&E, emergencies, accident and emergency, we do see a lot of young professionals shy away from here is because they do feel that, there are other lucrative options available, and those are the ones they tend to pursue. So broadly, these could be termed as three different factors, which are, three different drivers, and they have a lot of different factors within them, which kind of are facilitating change within, health and social care. Now, this slide basically expands on the population, which is one of the factors which I've discussed, and why, this will be required. Skills and competencies will be required in particular. Because we are living longer, and obviously, there is a need for engagement in particular when we look at this particular sector. So here, a lot of these jobs that we do and the services that we provide require personalized engagement to be able to understand and then provide these services to the patient or the individual. And that is why, this sector is also people intensive from a point of view of, to be able to deliver services. This is a slide which shows how there are global inequalities in healthcare resources across the globe. So we do get to see just a point here that we want to see that there are healthcare systems which have evolved now in developed countries, and some of these models are being adapted by developing countries. In some places wherein the population growth is explosive, that means there's a large explosion in population or growth pattern in the population. What we do get to see is that in those cases, the provision of healthcare services has to be expanded to provide these services to the growing population. So this is just a graph to show how we look at the growth of population happening, how the systems are evolving. But in essence, it talks about the ratio or the density of doctors and nurses across, or in terms of a ratio, 1:1,000. So that means how many doctors or nurses do you have in some of these countries per 100,000 patients, and what is the scale? So population growth patterns are putting pressure, which means that there are less and less number of individuals. There are more individuals essentially which are required to enter this sector to be able to continue to provide services because of the explosive growth of population happening. Again, a slide which really captures emerging economies in particular, wherein what we are seeing is when you look at large-scale development happening in countries like India, China, Philippines, and Korea, wherein the life expectancy was quite low after the post-World War II era, but because of the conditions of growth and economic, rise in some of these countries in terms of income and in terms of, better infrastructure, the life expectancy is increasing. And that means because the life expectancy is increasing, that means it puts a lot of pressure on the existing systems. If the government does not step in and kind of, expand the healthcare sector in particular, puts in investment, creates the infrastructure, it is going to be very difficult to offset, the requirement of, basically offset the economic growth vis-a-vis the features and facilities available within these countries for providing healthcare. So this is again a representative chart just to understand that in spite of economic growth happening in countries, the development of healthcare infrastructure is not keeping pace with the economic growth in that country. So there are lots of international agencies like the World Health Organization, UNESCO, which play an important part by introducing aid packages, by introducing, governance and legislation, and it kind of helps in policy development so that these countries are able to emulate that policy development and the measures to facilitate faster growth of healthcare services, which would keep up with the economic growth happening in this country or in some of these countries. Now, there are some of the other bits that we need to look at very briefly would be when you look at the three factors that we identified. There are some slides which are put under healthcare services, which which kind of put slight more data, a bit more data in terms of why this change is happening and why healthcare services is a key driver in terms of change. So when we look at, one of the key things is looking at reducing mortality rate. That means, the birth rates wherein when we are looking at, in general, how is that in terms of costs when we look at across the globe in terms of reducing mortality rates under 5. So when we look at the number of dollars being spent on an average, this gives us an idea that in some of the developing countries, when you look at conditions like hepatitis B, we look at vaccination for certain basic things like, polio, for example. We look at certain diseases like the, which are associated in general after birth for children, typically under the age of 5. There's a lot of spend required by these countries to try and ensure that they are able to provide, the right kind of treatments for, in this particular slide talking about under 5. So children, young children in particular under the age of 5, what is the provision required in terms of spend to be able to provide these services so that the, the rate in terms of success rate, mortality rate in terms of success rate, that means children who are successfully able to go over the age of 5 without, getting these medicines in terms of their survival becomes low. So this is something that we need to look at, just to give a perspective in terms of, what spends the governments need to do in order to keep the, mortality rate low. So when we look at mortality rate, essentially meaning, looking at death on a large scale. So under 5 in some countries, when you look at African countries, sub-Saharan countries, there the mortality rate is quite high. But when you look at developed countries, there the mortality rate is quite low. And because the advancements in health and social care sector, which means provision of some of the basic healthcare services is available, that is where the survival rate is higher and the death rate is lower amongst children under the age of 5. So it gives a perspective in terms of the amount of spend required on a daily basis to meet those conditions and provide those services so that this rate of mortality amongst the under 5-year-olds is, is reduced steadily over a point in time. This table also talks about, things like preventing and treating non-communicable diseases. Again, understanding some of the newer inventions, things like tobacco, alcoholism, obesity, heart diseases, diabetes type 2, which is high sugar. Now, these conditions have increased over the years because of the availability of fast food, the availability of, a lot of product substitutes, and this has also created pressure on healthcare services in general. So these treatments, if I look at, 4 or 5 decades back, we had mostly treatments happening for traditional diseases. But now when we look at say for example, we look at fast food in particular, obesity is going to be has been identified by World Health Organization as the one of the biggest killers up until 2040. So they see 1.3 billion people who are currently obese. That means they are, in terms of their basal metabolism rate, when we look at BMR, they are considered obese, and this is being driven predominantly through the consumption of high sugar foods, fast foods, and our living pattern currently, with not much exercise and healthy living, or some sort of a balanced diet being there. So when we look at that, there again is going to be a lot of spend and pressure on the NHS in particular, if you look at UK as a context, in terms of why this would be a driver for change, because they have to tackle some of these things today by doing healthcare promotion campaigns or by raising awareness amongst the consumers that these things have to be looked at now at a very young age for it to be, not a major threat, or within at least a treatable range when we look at the future years, when we look at 2030, 2035. So again, just a slide here, which basically talks about, the basics of understanding of why we are looking at, some of these new conditions arriving, and what is the appropriate spend which needs to be done, in terms of dollars, because this report is from the World Health Organization, and it talks about the average spend which the systems have to do in order to treat some of these diseases. So again, one of the drivers for change, it is something which is direct effect of our modern lifestyle, and the developments which are happening specifically in fast food and availability of foods and substituents. Now, the other things that we look at in particular is that when we look at the third table that we, third column that we looked at in that table was the availability of skilled healthcare workforce. And there are some slides which are put together which basically kind of talk about, the reasons why we need this. And one of them is identified as that workforce is typically required to do implementation of these services within, the sector. So if you don't have enough trained healthcare professionals, you don't have enough trained people to be able to manage these services, then this is going to be one of the key bottlenecks. Even if you have a world-class infrastructure, world-class system, but if you don't have trained manpower to be able to administer these services, then it proves to be a major bottleneck. And that is why the investment into the development of healthcare workforce is also identified as a key challenge, but also as a key factor to provide these services, and to provide these services in general to the public within any particular country or geography. So we look at human resources constraint. We look at, constraints on physical accessibility. Sometimes when you look at areas in particular, these areas, when we look at in particular these areas, which to a certain extent are not easily accessible, and then that would mean that there are constraints from that aspect. Logistical problems we look at is, for example, when some of these services have to be provided in far and different areas, then that have to be looked at from an aspect of logistical problems. So some of these are, bottlenecks that I've kind of listed down, primarily looking at healthcare workforce in general. And just the last bit, which was to look at how the changes are happening because of, changes in government legislation, the acts or the policies. For example, when we look at a lot of these acts which was introduced in the early 1970s, things like the Health and Safety Act, we look at, the NHS Act, which was introduced in 2010. We look at that these changes have been put in place now because we do feel that there is a requirement for having these changes, and some of these have been, kind of implemented by converting them into law and legislation. So let's look at a few slides which kind of, reason out why these are required. So one of the key things that we need to understand is we need to understand what is NHS and why it came about, and why, what are these changes, and, what are these law and legislation which are specific to the NHS. So I put together one or two slides which basically talk about, why NHS came about, how it is funded. So for example, funding is done through, obviously the taxes, the HMRC, but apart from that, there are other different avenues from which they get funds. For example, they get the funds from the Prince Trust, the King's Fund, and also direct funding coming across from, obviously the government in terms of, provisions for the National Health Service. But in general, the reason why NHS was created was that the government looked at providing medical service or, healthcare services coverage to the entire population, irrespective of background, caste, creed, and, demographics. And this then is provisioned under the Ministry of Health, and it basically has the healthcare department, and then underneath that you have the trusts, the hospitals, and then in order to monitor the delivery and implementation of these services, we have certain social enterprises which basically monitor the quality and provision of these services, like the Quality Care Commission that we look at. So just a brief background about why NHS, what are the strengths and weaknesses, and why we look at in the context of UK in particular, when we look at these services, how they are provided. Now, the last bit that I want to quickly cover is technology. Why do you think technology is also one of the leading factors which is kind of prompting changes in the healthcare sector? Now, one of the key things that we look at is the development of internet, connectivity in general. So if you look at 20-25 years back, there was no internet, and most of the records, patient records and everything were actually maintained manually. But because of digitization and the availability of internet, what this has allowed us to do is create records which can be easily accessed, across within the systems, and this has been made possible because of the use of internet. So internet has driven a lot of tremendous amount of change within this sector, which has led to the creation of accessibility, easy accessibility, and to a certain extent, faster and efficient speed of communication within various departments within this sector. Now, the other developments which are happening is the development of new equipments, new technologies, new machines and gadgets which are being introduced to treat patients' disorders and provide these services. And these are also leading to a fast-paced change happening now within this sector. So just an example here would be a couple of, I would say probably about 1 or 2 decades back, if somebody was diagnosed with a condition in terms of heart, what we would have seen primarily was that if there was a severe blockage in the arteries, the only possible remedy was an open heart surgery. But in the last 2 decades, what we've seen is the development of stents. And what that has meant is, as a technology, without undergoing the open heart surgery, the patients are, the doctors are able to treat the patients by introducing stents which remove blockages within some of these arteries. Now, this is predominantly because of the development of, new instruments or new, let's put it this way, machines or gadgets, which are able to allow doctors to do the surgery and introduce these as, pieces of, instruments or pieces of, let's say, medical instruments which allow them to treat the heart blockages. Now, with the advent of technologies, what has happened is you have medicated stents and you have non-medicated stents. That means there is no reaction to the introduction of an alien body within the heart, and the patient is able to, get discharged in 3 days. So these successive developments are nothing but developments happening because of technology, and that is why you get to see that this is one of the major driving factors when we look at change happening within this particular sector. Is that okay?
Yeah, that's fine.
Now,
yeah.
I'm going to kind of stop here. There are some other slides which I've actually put together in this particular learning out, but these generally are to talk about more in a bit more depth about the reasons why these changes are happening and why the sector is being reformed, why there are changes happening on a yearly basis because of in general the broad factors we've discussed, but it will go into a bit more detail to put some more kind of details to understanding the change and the reasons for change and what are the challenges with this sector actually looks at. Is that okay? So main parts would be covered until slide 20, but after that, I think what I've done is I've put some backup slides up, which are providing you more basic in terms of, to understand the healthcare system, the factors which affected, the economic factors which affected, the physical factors, financial factors, and the, social factors which affected, and why in general there's a reform happening within the system, and that is reflective of nothing but change happening because of the new challenges which this particular sector is facing in order to, provide better care and maintain the quality of care being provided to people and individuals receiving this service. Okay?
Yeah, that's fine.
Good stuff. So what I'm going to do is we'll end the session here today, but what I'm going to do after the session is email a copy of this presentation, which is going to be a general practice, and also send you a small handout, which is going to be a Word document, which will give you some more detailed reading about some of the key factors that we've identified in today's discussion, and also the challenges of why these factors actually pose challenges for reforming this sector in general. Okay?
Yep, okay, that's fine.
Any questions on this here, Wellington, so far? Anything that I've not understood?
No, I think it's been clear.
Okay, good stuff. So if you still have any queries, if you have any questions, then feel free to drop me an email, and I will come back to you pretty much on it straight away with regards to either providing you some additional information or some additional reading material to clarify those queries.
Okay, that's fine.
Okay, brilliant. Yeah. So you've got the invites now, which are available